Hello and welcome to the episode 3 in our scoliosis channel, and today we're going to be discussing the word of false or pseudo scoliosis. We know that not all curvature are scoliosis. We have a bunch of other types that we call it false or pseudo scoliosis that you need to distinguish between this one and the real actual structural scoliosis. On this false scoliosis, we have lots of different names. It could be for functional reason, postural, antalgic. Functional, for example, the patient with leg length discrepancies, either congenital, traumatic, the patient with pelvic tilt. It has a lot to do with um, balance and function of different part of the body that can lead to a pseudo or functional scoliosis. We have postural scoliosis. It happens through translational imbalance or overloading in one side of the body. And also we have antalgic scoliosis that also due to a different cause like disc herniation. The patient will lean towards one side for antalgic purposes. Spondylolisthesis, sciatica scoliosis, patient will lean away from the pain. We call this antalgic scoliosis. And all this different type of false scoliosis you need to recognize in order to offer the proper diagnosis and the proper management. The main basic things between false scoliosis and real scoliosis, as we discussed before, is this is non-structural scoliosis versus the real scoliosis, which is structural disorders or disease or curvature condition that has changed on the frontal plane, sagittal plane, and a horizontal plane. The rotation or the torsion of the body, of the vertebral body, it's a 3D actual structural disorders that we can call scoliosis. So we're going to put this on the side and we go now and manage the pseudo scoliosis. We need to understand how to manage this pseudo. I don't want to say easy scoliosis, but it's fake. It's antalgic. Once you treat the cause, it will be gone. I know some numbers like from 25 degrees postural scoliosis down to 15 degrees in 2 weeks of management, which of course is magic if we could do the same or even close in the structural scoliosis. But for now, for the pseudoscoliosis, we use orthotics, leg high or leg discrepancy, leg length discrepancy. We use orthotics, leveler, foot leveler. On the antalgic or postural scoliosis, we can use stretch exercise on one side, strengthening exercise on the other side, increase the core exercise for stabilization. We can use the yoga for scoliosis, mirror image exercise, scolioroll, on the scolioroll by both active exercise and passive exercise or traction. Thoracic translation, rotation, using the CPP technique, and most of the chiropractic doctors will know what I'm talking about. And most of also chiropractic doctors use what we call it the orthostem, which is an electric device that stimulates certain or bunch of muscles group, the ligaments. Of course, chiropractic adjustment helps in that, and management definitely for underlying disease, like if the patient has a hernia, if the patient has sciatica, spondylolisthesis, several adjustment or protocols in hernia treatment or sciatica treatment, applying this protocol. Once we're done with this, the antalgia that the cause from this particular pain comes from sciatica or herniation or whatever will help definitely and resolve the pseudo scoliosis. Proper ergonomics, that also would help on postural and functional pseudo scoliosis. After that, we can talk about scoliosis, the real deal, the real scoliosis, the real structural, the real beast. That's the structural scoliosis. Of course, it could be due to several different items or different diseases or different causes. The main causes, the majority of the real one, is congenital, mesenchymal, genetic, neurogenetic, neuromuscular. I want to put two epigenetic here on this particular classification, which is the environment that controlling the genetic presentation. Traumatic, paralytic, osteochondrostrophy. It could be tumors, metabolic, degenerative, iatrogenic, post-surgical, and iatrogenic for different reasons. Maybe bone softening chemicals or drugs and stuff like that. But if we notice here all this actual diseases that we're going to discuss in details in eventual episodes versus the idiopathic unknown causes, which counts for 80% of all scoliosis. So idiopathic, we're going to subdivide the idiopathic to early onset and late and adults, but the idiopathic, the unknown, the IS is 80%, counts for 80% of the cases. No wonder it's the most research are covering this particular category, and also not only the research but management, diagnosis, treatment, literature has lots and lots more comparing to other stuff. Other stuff is easy, congenital, okay, the baby were born with Klinefelter syndrome or wedge or butterfly vertebrae that leads to scoliosis. Oh yeah, the traumatic or the tumor, metabolic, degenerative in older people. It's very obvious, but the idiopathic is the main challenge. So 80% is idiopathic scoliosis, and that's actually the main thing I want you to take home from today. After we discuss the pseudo scoliosis, antalgic, postural, functional scoliosis, false scoliosis, I want you to take home the idiopathic scoliosis, IS, is 80% of all the cases. And this will actually, there's a reason for that, because from now on, all our discussion will be targeted for this 80%. If we have 100 patients, 80% or 80 of them will have idiopathic scoliosis. It doesn't matter if it's infantile, juvenile, adolescents, or even adults. It's the big portion of our scoliotic patients. This was a fast episode about the false scoliosis, and I hope this channel is, as you all know, is for scoliosis healthcare provider, physical therapist, medical doctor, doctor of chiropractic, or surgeon, nurses, and also radiologist. More important for scoliotic patient and their family to fill the gap among different scoliosis clinicians through the scientific literature and research paper. My name is Wael Abdullah. I hope this fast episode was beneficial to you, and I'll see you next time in our fourth episode when we dig down to the real scoliosis management and diagnosis. Thank you, and you have a great day.